I'm Dr. Howard Zucker, the doc in Docology. This year, nearly 500,000 Americans will die from smoking-related illnesses. Now, that might surprise you because you probably don't know many people who smoke anymore. The number of adult smokers in the United States has plummeted ever since cancer warning labels were placed on cigarette packs back in 1964. But one of the most effective tools for bringing down the rate of smoking and keeping it there has just been closed by the Health and Human Services Secretary, Robert F. Kennedy Jr. The Office on Smoking and Health at the Centers for Disease Control that tracked the rate of Americans' tobacco use every year was instrumental in reining in vaping companies. It was instrumental in making sure that kids didn't use vaping as a way to end up getting addicted to cigarettes as well. It funded those compelling public service announcements from former smokers on their deathbeds. And we've all seen those. They are very compelling. And it underwrote the telephone quit lines those ads promoted, which have led to millions to kick the habit, which essentially has saved millions of lives. And on April 1st, all 120 staffers of the Office of Smoking and Health were fired. So now what? Well, to answer that question, we're fortunate to have one of the most impactful voices in the battle against tobacco over the years. And that's Matthew Myers. He co-founded and led the Campaign for Tobacco-Free Kids. He served as its president and CEO for 25 years, and his work has helped save countless lives, especially young ones, by keeping kids from ever picking up that first cigarette or that vaping pen. And his legacy is one of real, measurable impact, and it's a true honor to have him here with us today. Welcome, Matt.
Thank you. It is my real honor to be with you and to talk about, unfortunately, to have to talk about this issue would be.
Yeah, I know. And it is a very important issue. Maybe we could start with history. How did you start the Campaign for Tobacco-Free Kids, and what was it designed to do back then? I mean, this is an amazing accomplishment.
You know, you could never have dreamed that we'd live in the world today when we formed the campaign. In 1994, when we first began to do work to build the campaign, which opened in 96, over 36% of our high school students smoked, 25% of adults smoked. Only 2 states in the United States actually protected people from secondhand smoke with regard to that, and we were on the wrong path. The reason for creating the Campaign for Tobacco-Free Kids was to change how we did tobacco control in the United States. And the results, fortunately, have been extraordinary. But it's also important, Howard, to understand the incredibly important role that the Surgeon General, the Centers for Disease Control, and much more recently that the Food and Drug Administration has played.
Right. I mean, it is quite amazing all that the public health community did to tackle this problem. And it is very unfortunate when you see that things have started to change. When you did this, tell me a little bit about, like, sort of, did you expect to achieve what you have achieved to date?
I put it 2 different ways. When we created the Campaign for Tobacco-Free Kids, we knew that what we were doing as a public health community wasn't enough and that we needed to do much more. We were also formed at exactly the time that the science about what works was really being developed, that we were learning for the first time just how impactful protection against secondhand smoke, community programs funded by the state and local level, increased taxes were. And for the first time, we really knew that if we did our job as political advocates and the states and the federal government did its job, we thought we could make a dramatic change. But if you ask me the question, did I think we could make as much change as we did? The answer would be no. Literally, 1 out of 3 kids smoked when we started. Today in high school, fewer than 2% of high school students smoke.
Isn't that amazing? Isn't that amazing when you think about it? Because I remember when I was in high school, you see the kids go out on the street, right? Or they go into the back and in the corners of the high school, they smoke cigarettes, and you see all the cigarette butts out there. And it is sort of amazing that the kids just aren't smoking as much anymore. And it is really an effort that's been made by so many individuals. So you think that you wouldn't have hit this level of success at this point?
I actually worked on legislation with then Congressman Henry Waxman to project future smoking rates among kids and to penalize cigarette companies if we didn't hit it. We have so far exceeded that. But, it's important to understand how that happened. When you and I were growing up, the Marlboro Cowboy rode across our screens. He was a billboard in every baseball stadium in the country. Joe Camel, a
Joe Camel.
cartoon character, was luring our young children. The Virginia Slims woman was making smoking attractive to our young girls. It was part of their independence with regard to it. We live in a fundamentally changed society because of the combined effort of advocates, state and local governments, and the Centers for Disease Control.
And we also had cigarette smoking on airplanes, right? Because it was the smoking section versus the non-smoking section, which seems sort of ridiculous when you think about it. And even I remember as a resident or even as a medical student and afterwards, the smoking in the hospitals, there were literally areas that said you could smoke in this area, which is unheard of today, or a
Well,
restaurant.
it speaks to the cultural change. Along with flight attendants, I worked on the early legislation that banned smoking on airplanes. Nobody thought it was possible. I was told that there'd be riots on airplanes when that happened. My wife was a senior administrator at a university hospital, and she told me that surgeons and doctors resisted enormously when they banned smoking inside there. Today, it's unheard of.
Right.
We can't even imagine that there was a day when you got on an airplane, lit up a cigarette, and smoked it. Both the fire hazard, the risk to it, let alone the fact that we were all sitting there breathing in that air. And
Secondhand
part of what changed it was, flight attendants actually died of lung cancer at higher rates than other individuals.
I, I
And
did not know that.
that doesn't happen today. It's one of those great unspoken public health successes.
So where are we headed now? Where are we headed with kids smoking and vaping, given the new administration? Are we headed backwards? Are we headed in the same path we're going? Tell us a little bit about that.
Well, I'm a half empty, half full kind of guy. I'll have to admit to you on this. What the administration has just done to the federal effort on tobacco use is not just a disgrace, but it will result in more deaths than needs to happen. Over the last 10 to 15 years, the CDC has played an enormously important role in educating our young people, tracking the data so that we know what's happening and can respond to it. One of the things that people don't realize is the CDC is a major funder of state health department tobacco control efforts with regard to these issues. It makes sure that the state health department knows what works, that it gives it the best science. With one fell swoop, the Trump administration has eliminated not just the office, but all of the people and the expertise that does that. The potential for backsliding is enormous. But, I am also a believer that if we in the public health community, and that means all of us, refuse to allow this to happen, we still have the power to make sure that the progress we made doesn't erode. The example I mentioned earlier, when I started doing this work, every day I was combating the Marlboro Cowboy. When moms and dads sat down and tried to tell their kids why they shouldn't smoke, they had the Virginia Slims woman tennis tournament on TV counteracting that. We've succeeded in removing those. What's absolutely crucial is that those of us who care about preventing kids from ever starting use this as a clarion call to pick up at our efforts at the state and local level to make sure that kids in school continue to hear not only about the health problems caused by tobacco, but how the tobacco industry manipulated them into thinking it was cool. We succeeded in making not smoking cool. We have to make sure that even though we will no longer have the Centers for Disease Control helping us, that we continue to make that message loud and clear.
But is there a point where the rate of smoking is so low that just from what the administration is saying, that the office doesn't need to exist anymore? I mean, that's what I guess I'm hearing a little bit from them. So
I don't think you're hearing anything clear from them. They chop the Office on Smoking and Health at the same time they chop the Office on Chronic Disease. At the same time, they chop the office that deals with drowning, that deals with vaccines. They were just putting a club to everything positive that the Centers for Disease Control does. But to answer your question, I've heard this question before. Have we reached a point where we no longer need to do the kind of rigorous tobacco control efforts that we've done in the past? And the answer to that is no. As long as there are tobacco companies who make billions of dollars selling cigarettes, there is a need for the public health community to continue to inoculate our children, to warn them of the health hazards, and to beat back the ever more subtle but still continuing to exist marketing efforts of the tobacco companies. It has been true in this country for decades. 80 to 90% of all long-term smokers start as children. The tobacco companies recognized it long before we did, and recognized that the high school student was their new market. As long as they make money off of selling cigarettes, they're going to continue to try. And unless we continue to do our job, we will see a rapid erosion of the progress we've made.
So you've hit two key points here. One I wanted to get into about kids, addicting kids, but also the tobacco industry. So we saw that lawsuit, right? The big tobacco lawsuit settlement. And in what ways are these companies now continuing to push, maybe quietly, insidiously behind, the radar to claw their way back in? So tell me a little bit about what you think they're doing. And then in addition, a little bit about vaping. And are they trying to pull others trying to pull kids into vaping and addict them that way?
Well, first, let me say, it isn't quiet or behind the scenes. It's just invisible to adults. And that is, even though it is now illegal for them to be, quote, advertising on social media, illegal for them to be advertising in many other places, they continue to look for ways to create images to make smoking cool, to make the cigarette pack look cool, to have the cigarette pack sold near schools all across the country. The recent data shows that particularly if you live in a low income area of your city, your local convenience store will be bombarded with images of cigarettes all over the place. The other thing they've done is, just as they did with low-tar cigarettes 50 years ago, they recognize that if they can get a kid addicted young, they've got them. And what is that? What did we see? Between 2017 and 2019, we saw the most rapid rise in nicotine use among our nation's children than we've seen in 50 years. This time it was e-cigarettes, many of them sold by Juul, but other tobacco companies as well. And what they've learned how to do is deliver nicotine more effectively, more rapidly, and more intensely than cigarette companies ever could. So we run a real risk that those young people become addicted to one product, stay addicted to nicotine, and we simply don't know whether or not that will lead to a resurgence in cigarette use or long-term addiction to nicotine in other forms.
So we have some organizations, obviously, who are supposed to tackle this, like the FDA, right? So we have a new FDA director. What do we do? What do we tell him? How does he tackle these risks to children regarding tobacco and e-cigarettes? I know there was a whole issue about getting the nicotine levels down, and there was a push towards that in a couple of years ago or recently. Where does that stand, and how do we address that?
It's a great question. The FDA was given the power to regulate e-cigarettes. Had it moved earlier in 2015, we may never have seen the epidemic among youth use that we did see. And in the first Trump administration, they basically looked the other way while e-cigarette use exploded until it got so bad that they had to act. Under the Biden administration, they didn't do as much as we wanted, but they haven't approved or authorized flavored e-cigarettes. 80 to 90% of kids who start using an e-cigarette use a flavored product. They basically curtailed that, along with states like New York that banned most flavored e-cigarettes, Massachusetts, which banned all of them, California, which banned all of them. We've turned the corner, and e-cigarette use is down. One of the first things the Trump administration did was it fired the head of the Center for Tobacco Products at FDA and the head of science at FDA. There is a real fear that under a Trump administration, FDA will allow the same kind of e-cigarettes that caused the e-cigarette epidemic in the United States in the first place to reemerge and to begin to appeal again to our young people. I mean, we were talking about flavors that no adult would use, but which were very popular among kids.
And they had
That curve,
names. Yeah, they had
huh?
great names. They had great names to them too, right?
They had great names, and they were companies all across the board. Virtually all of the e-cigarettes are made in China and imported into the United States. With regard to that, and they have demonstrated that they're prepared to use all the marketing tools and tactics that the cigarette company used decades ago. What happens now if the FDA takes its foot off the gas? If it allows those products to come on, that's a real concern of all of ours.
So basically what you're saying, you need to keep pushing on this. And there's no, you mentioned about the gas. If you take your foot off the gas, the whole thing will start to unravel. You mentioned a little bit about legislation before, and I thought maybe I'd take you back to this office at the CDC, because that was created through legislation. Can you talk a little bit about that? Because you were on the front lines of that. And what has
Well,
happened now? What does it mean now?
yeah, people don't realize the importance of the Office on the Centers for Tobacco Control. The CDC OSH has been the place where we both track what happens. It has been the place where we study the science. It provides the scientific backbone for the Office of the Surgeon General and the Surgeon General's reports. It has been the place that has helped us learn about all of the different health hazards of smoking. It is the place that has identified how tobacco industry targets the African American community, the LGBTQ community, the tactics it uses to get to our kids. It is the office that shares that science, both in terms of the harms of tobacco and how to prevent it, with all of our state health officials who are the front line on this battle with regard to that. It's the early warning system to identify new trends. It saw the e-cigarette trend long before the government moved to do it. Without that, we don't have the tools to identify what the companies are doing. We don't have the tools to identify new strategies and tactics that they're doing. And we don't have an office to provide the kind of objective, well-done scientific research that is the backbone of the tobacco control community. So it is a gaping hole in our efforts to reduce tobacco use.
But this goes also to the issue of saving money, right? So they're saying they're saving money. Talk to me a little bit about that, because the legislation was set up a certain way about that money that was creating that office.
Well, so there's two things that I think are really important with regard to that. First, tobacco control is one of the most cost-effective things government does. For every dollar we spend in reducing tobacco use, we save $3 to $5 in healthcare costs. And the other thing we save that people don't realize is one half of the people who die from tobacco use die in the prime of life. Those are mothers and fathers of small children who are still dependent on them. And that gets ripped away. But any shred that this is about cost saving is ridiculous. The Center for Tobacco Products at the Food and Drug Administration is not funded with taxpayer dollars. It is funded 100% with mandatory fees on the tobacco companies. So every dollar saved is a dollar saved by a tobacco company, not an American taxpayer. And the legislation was carefully written so that it actually forbids the government from moving these dollars to some other purpose, so that it's not being diverted to some other good purpose. So when they fired hundreds of employees at the FDA, when they got rid of the head of the Center for Tobacco Products, taxpayers didn't benefit $1. The only institution that benefits by lowering government costs is the tobacco companies. And you can be sure that that money is going to be moved into marketing and other things that don't do any public health good.
So it's going to push us backwards. If you were the CEO now of Tobacco Free Kids, what would be your number one priority then, given what you're saying about FDA, CDC, and all the other challenges of the tobacco industry? How would you tackle some of these things, given what we're seeing?
Well, the Campaign for Tobacco Free Kids is doing it. I think we're doing several things, and we all need to be doing several things. First of all, we need to recognize that we were making progress reducing tobacco use before the Food and Drug Administration had authority over tobacco products. We were also making progress before the CDC really stepped up in the way it has recently. Shocking to me is the first paid public education ad funded by the CDC was under the Obama administration. What it says is that states and local governments led the way in the beginning. They've gotten lazy. They've stopped leading. It is time for state and local governments to come back to the fore and take the leadership. You live in New York State. In New York, they continue to get money every year from the tobacco companies as part of the Master Settlement Agreement in 1998. It's time for states like New York to refresh their commitment to funding tobacco control programs at the state and local level. It's time for states to increase their taxes on tobacco products, which we know will reduce tobacco use. It's time for the states to curtail where cigarettes are sold so that they're not sold in the communities where we have our most vulnerable populations and where we have our kids. And so there's a great deal that we can do even without the federal government providing the lead, at least in the short term. This is an area where if we all remember how we started, we can make sure that we don't see our progress eroded.
So don't let history repeat itself. That's the bottom line, right?
That's absolutely right. You know, this is one where we can all sit and bemoan what they've done, and we should. But it's also a place where we need to renew our own commitment to doing this. You know, New York State is a perfect example. After the Master Settlement Agreement, New York State funded one of the most effective statewide community-based tobacco control programs. It's one of the very few states that saw a reduction among every population base there was because of what the state did. It's time for New York State to say, we're going to take the lead once again, and every state needs to follow suit.
Well, we led, when I was a commissioner, we led with the e-cigarettes and the contaminated e-cigarette issue. I will say, I was thinking about what you were saying about years ago. I remember when I was a little kid, my parents would not let me go into the neighbor's house because he was a chain smoker. And he just smoked all the time. I could see them and meet with them, but they didn't want me sitting there with all that cigarette smoke. But I also remember, because he was in a wheelchair, he had emphysema already, that he would send me down, like as a kid, to the store to buy cigarettes for him. And they sold it to me. I must have been like 10 years old, 11 years old, that they just sold me cigarettes to bring back. And I remember the whole containers and cartons is unbelievable. But we have come a long way in fighting tobacco. And this is really a testament to all that you have done. You've done an amazing job. And I'm sure when you look at some of these things, you say, we can't go backwards and just keep pushing forward. And it is great that kids don't view smoking cigarettes as cool anymore, which is a real success. And like I said, all your work and effort to achieve that. So I am thrilled. We've reached the point now in the show where we turn to our most important guests, which are our subscribers that are out there. I want to tee that up, but a quick point I always make is that all of what we say in the podcast is for informational purposes, and it's not in place of a doctor's visit. If you have a medical question, you should surely speak to your doctor who knows your medical history the best. But let's turn to our subscribers and hear what they're wondering about. I'm sure there are a lot of questions out there. Kat, who's our first one?
Well, lucky for you guys, the first question is from me.
Oh, excellent. Perfect.
So I've heard a lot of arguments about vaping and e-cigarettes and smoking and all of that stuff. And I actually was just having a conversation with a friend about vaping, and they were like, vaping is so much better than, smoking regular cigarettes or whatever the case may be. And I'm curious how you would respond to that argument, and what's the best way to sort of help people understand that that's probably not as accurate as they'd like to think.
I think the first thing I'd respond is, contrary to what we were told, the large percentage of the people who vape never smoke cigarettes. And a large percentage of them were kids who were never addicted to anything. These products were designed to appeal to non-smokers and often what we find is those people are addicted before they even realize it. What we know from science is that the earlier you become addicted to a substance like nicotine, the more susceptible you are to addiction throughout your entire life. So the short answer is whether or not e-cigarettes long-term turn out to be safer or not than cigarettes, and there's a lot we still don't know. The one thing we do know is that if you're a non-tobacco user, e-cigarettes dramatically increase your risk of harm. And it's not a pathway to a healthful life with regard to those issues whatsoever. The other thing that I think is important to understand is that e-cigarettes deliver nicotine more powerfully, more rapidly, and more effectively than cigarettes ever did. So much of what we know about the relative role of nicotine with regard to cardiovascular disease and other issues, we can't be certain that the same will be true because we're applying doses of nicotine to young people that is dramatically different than what they've ever had before. So yes, it's true that lung cancer and other diseases like that are caused by the tar, but e-cigarettes contain levels of nicotine that are unprecedented, and they deliver toxicants into your lungs that are different than we've seen from cigarettes. I don't want to wake up 25 years from now and say long-term epidemiology has proven that these are a disaster. The only answer to them is if you really care about your lungs and your heart, the best thing you can do is don't use any tobacco product and don't use nicotine.
Fantastic answer.
Right. That should be bumper stickers and posters everywhere.
I'm going to send this directly to my friend.
Good.
Thank you so much for that. I'm going to bring up John, who has a question.
Yeah. Hi, Mr. Myers. And thank you for everything that you've done. It must feel good to have saved many, many lives like that. Not a lot of us get to do that. I'm wondering if you could talk about chewing tobacco or dip or all of that. It's got some cachet among especially young MAGA bros these days. What do we know about dangers?
It's a great question. It's a great question. 2 seconds of history for you. Chewing tobacco was a dying habit in the United States until the early 1980s, when a major tobacco company, U.S. Tobacco, introduced a new, sleeker version and used a bunch of professional athletes to advertise it. And for the first time in decades, got young people hooked on it and started on it, et cetera. Many of us worked on getting those ads off of television and then trying to make sure that people understood that chewing tobacco was a cause of serious disease, including cancer. A little success you may not have realized. But over the last 10 years, the Campaign for Tobacco-Free Kids and others worked with Major League Baseball. And city by city, we have gotten chewing tobacco out of baseball. If you live in New York City, it is now illegal for a player in Yankee Stadium or Citi Field to chew tobacco. And that's the case in 16 of the 30 baseball stadiums across the country, which is why our young boys no longer see it. And the affiliation between baseball and chewing tobacco is rapidly eroding. The concern you're raising is a really legitimate one. The tobacco companies have introduced a host of new products, Zyn and a series of others, that deliver very high levels of nicotine very effectively without all of what I call the gross parts of chewing tobacco. And so they have created a campaign to make these products cool among our young people. We have been very slow in counteracting that and making sure that young people realize that we don't yet know the long-term effects of these, but the addiction to nicotine from these products can't be good for you in the long term. It's one of the reasons why I am concerned about the Trump administration getting rid of the CDC. It was playing a leading role in producing solid, scientifically based public education, getting that to state health departments and helping to communicate that, as was the Food and Drug Administration. So it's an area of concern that we need to watch. Those products may not be as disgusting as traditional smokeless tobacco products, but they run the risk of undoing the progress we've made in reducing the use of smokeless tobacco products among our young children, particularly among young boys.
Thank
So
you.
do you think the state, so you mentioned the states have to step up on all of this, and if the CDC doesn't, but also on these issues of chewing tobacco and many of the other tobacco products that are out there?
That's exactly right. And in this one too, you know, New York State, for example, did ban virtually all flavored products. We need to make sure that flavored smokeless tobacco products don't sneak their way in a lot of places, that states enforce the few states that have good laws enforce them, and the states that don't have them step up to the plate and adopt them.
Can I ask another question?
Oh, sorry, John, go ahead.
Just because you triggered in my mind, were the tobacco companies heavy contributors to the Trump campaign?
Very heavy.
Sides? Oh,
very heavy. R.J. Reynolds and the Vapor Association are among the major contributors to the campaign. So it is a reason for concern, and it's a reason for vigilance, and it's a reason for us all speaking out loudly to ensure that that doesn't result in not just wiping out our protective offices like the CDC, but them actually doing affirmatively bad things.
Prior to this moment, was tobacco regulation a nonpartisan issue, or has it always been more a Democratic issue than a Republican?
Well, I've done this a long time. During the first 20 years I did it, it was a nonpartisan issue. You know, it was sometimes it was a regional issue, but Republicans as well as Democrats actually didn't want their kids to smoke. Indeed, when we passed in 2009 the legislation giving the Food and Drug Administration authority over tobacco, it was a totally nonpartisan bill. In the Senate, it was led by Chris Dodd and Ted Kennedy on the Democratic side, and many people surprised John Cornyn on the Republican side. But as we've all seen, our Congress has changed. And today it is very hard to find leading Republicans willing to step up to the plate and speak out about these issues. There are a couple of, but not many. And we've seen it most rigorously over the debates over flavored e-cigarettes that were being sold around the country. We lost a big supporter when Mitt Romney retired. But people like Lisa Murkowski and Susan Collins have traditionally been very good about this issue, but it's hard to find them these days.
Thank you.
Great. Thank you. Great questions, John. Great questions on that. Kat.
That was the last of our questions.
So I actually wanted to sort of ask a little bit about the next steps. Can we push new legislation through, or do you think that would not go through with this particular Congress?
Yeah, I think it is highly unlikely that strong, good new legislation would succeed in this Congress. There's just too many obstacles. It's too partisan. I think my hope is that we will be able to work with FDA so that they don't do harmful things. And that's still unknown because we don't yet have a new head of the Center for Tobacco Products, and the person who left was superb. But I think we really need to look at the state and local governments for the areas of future progress on this one. We will work to try to defend the public education campaigns that both the CDC and the FDA were funding, because they were both cost effective and proven. But I think it is time for us to turn our efforts to the state and local governments and say to them, this is your time to succeed, and you can. We know how to do it. You know how to do it. You've done it in the past.
Well, if I could zoom RFK Jr. right into this call now, and you had an opportunity to talk to him about anything you wanted to regarding tobacco, because I'm sure you probably want to talk to him about a lot, what would you tell him? I mean, what would be the three things you'd want to tell him, or one thing you'd want to tell him about this issue, given your history of what you've done successfully?
Well, I think where we would start is he says his top priority is protecting the health of America's children from long-term chronic disease. There is nothing he could do that would have a greater positive effect than continuing our battle on tobacco. There is no single substance that causes more harm to our children than tobacco. There's no single substance on which we have more science, both about the harms and how to prevent the harms from doing so. And that he simply can't accomplish his top priority goal, which is protecting America's kids, unless he includes tobacco in it.
I think that's a great point, right? If you're going to make Americans healthy, start with young kids and start with preventing them from getting addicted to cigarettes or e-cigarettes, for that matter.
And he says his priority is protecting America's kids from things that cause chronic long-term disease. There is nothing we know more about than tobacco in terms of causing chronic long-term disease, where virtually all of the users start as children.
Well, if I get him on, I'm going to share your words with him, but I'm not sure that will happen so fast. But if I can get him on, I'm going to tell him exactly what you said, coming from the expert and the superstar on this issue. I will mention that when I was talking to my mother the other day about relatives and how long different relatives live, and we were looking at my grandmother, who had like 10, 11 brothers and sisters, and all of the ones who smoked died young, and all the other ones lived into their 90s. Or even 102. And I realized that was the one difference between the ones who died young and the ones who lived a long life. So it's
in the United States, you can actually look from state to state and often zip code from zip code. And if you know the smoking rates, you can take a look at life expectancy, and they're directly related to it. There was a wonderful study that was done only a couple of years ago that looked at the region of Western New York, Western Pennsylvania, and Eastern Ohio. Contiguous areas, equal economies, but different smoking rates because of differences in state policy. And they had dramatically different levels of life expectancy that were directly tied to smoking rates. What it shows is that even in the same economic, cultural environment, what you do about smoking makes all the difference in the world.
You can't argue with data. You just can't argue with data. Matt, on behalf of all the American kids out there who have not smoked, thank you. Thank you for coming on the podcast. You have literally saved millions of lives, what you've done. And it's just an honor to have an opportunity to talk to you about this history and about where you see things going. So thank you very much. That is it for our show today. Next time on Docology, we're going to hear about how medical research gets published. It goes sort of to the issue of what we were just talking about with data. And is the medical research world at risk today? From the former editor-in-chief of JAMA, Journal of the American Medical Association, one of the leading medical journals in the world. So remember, if you are a Docology subscriber, you can join the show. You just have to click on the link in the bio and tune in next time, because the topic we cover may just save your life. Docology is a production of Hang Media. Our producer is Catherine Warren. Ronnie Selig is editorial advisor. Our creative director is Anna Richard. Janine Wilson of Wilson Media Group handles paid marketing. Our publicists are Leslie Ann Wade and Jerry Caracoli. Theme music was composed by Nick Kitts. Subscribe and join our community at docology.life. Until next time, move, wash your hands, and stay healthy.